He rationalizes the salary increase in much the same way as the Prime Minister did in his Independence Day address. According to Hulse, while the write-off of the existing debt at the KHMH offsets the amount being used for the wage adjustment, there are many Belizeans who can't afford to pay their medical bills in full. He says that the hospital needs to embark on a more rigid bill collecting method.
As you know, the KHMH employees are not public officers, so they were not subject to that grand bonanza that the public officers were subject to of 6 and 8%. However, the government has to put a serious subsidy into the KHMH because it's not a self-sustaining institution, and of course health is a priority. So what we have done is we have asked the board to redo their budget, and as he rightly said, it's not just a handout, it's to redo their budget to look at areas that they can improve in efficiency, collection, reduce waste, and then government is prepared to supplement the budget. One of the ways we are supplementing it is through this $9 million which they were unable to collect. And God forbid somebody is in an accident or somebody has an emergency and go to the hospital. It's not a private hospital where you can say, well, go to the counter and pay the check first. You have to attend to the person. And when you attend to the person, the person says, well, I can't pay. Then what do? You know, you sue them, already that becomes, and this is how this whole large uncollectible came about. So with that receivable which is on the books of the KHMH being written off, so to speak, and government saying, okay, well, here is the money, they also have to put in a structure of how we can collect, because it is not everybody that is incapable of paying. There are some people that can pay, and the hospital has to pursue those persons and put in a system to collect. The government is also looking at a facility for really indigent people and people who then really truly cannot pay. And so that is how that came about.
So, but as to the number of the 14%, is that accurate?
I think it is. I think it is. It's a figure that I would have to be clear with the board, because remember that it's the board and the management that's responsible for that increase, so to speak. The way it's working, technically, is government is going to give the additional subvention to the hospital to cover everything, including the proposed increase to their staff.
After the break, a year later, we revisit the murder of Danny Connerty, the tourism police officer.